Talk to a chronic pain patient or a chronic ill patient or somebody who's struggling with depression. It's not that they don't want to be clean. It's just they have to make a decision. Am I using that energy to get a shower, or am I going to cook dinner for my family tonight?
Hello everyone, welcome to another episode of Eclipse Unscripted. I'm your host, Dr. Dustin Leek. I'm a pain management specialist here with Keith, leader of the Invisible No More group.
Yep.
Thank you for being here, Keith.
I'm happy to be here. Thank you for your time.
So I'm actually looking forward to this topic today. Essentially, it is difficult to be a pain patient in today's modern age.
It is.
And so I think we get the opportunity to hear from the side of patients, the side of physicians, what that looks like, what's making it so darn difficult. And before we get into it, let's hear from Jamie, who sent in her video message today from her experience, why it's so hard to be a pain patient.
Hi, my name is Jamie, and I'm part of the Invisible chronic pain community. I became disabled shortly after my pregnancy 17 years ago. So I've been a chronic pain patient for 17 years. I've seen the pendulum swing from one side to the other. It's getting harder every single day to be a chronic pain patient. I've seen so much in just the last 2 years where I've been affected by national shortages. I was affected for a month where I couldn't get my medication. I've lost 3 different pharmacies because they stopped being able to fill my prescription. I was just dropped from another pharmacy, Express Scripts, due to safety reasons, they said. They couldn't tell me why, but they called my doctor and he told me, according to him, that they treated him like a drug dealer. They didn't want to do long-acting and short-acting together. They told me on the phone when I asked why, they said, well, we just won't fill this prescription as needed, as it's written, that I had to taper. And I'm like, I'm not above the 90 MME. I already tapered my long-acting down to the minimum in 2020. Like, I've already done all the things that I need to do. I've never had a red flag. I'm like, there's no reason for me to taper. And if I do, I will be harmed. I will lose quality of life. So that's been really difficult. I'm hoping to find another pharmacy that will take me. Otherwise, I'm not sure what I will do. But, chronic pain patients are being harmed. The DEA needs to get out of healthcare. The government needs to stop putting their moral views on science. Someone needs to help us because it's getting worse every single day. All right. Thank you.
Yeah. She speaks the truth. I've not met Jamie before, but I've certainly had those experiences on this side of the fence. And so far, I have not had any pharmacies decide not to work with me. Suppose that's always possible. But I do know doctors that actually I get their patients.
Yeah.
I get their patients because their doctors' prescriptions, the pharmacies won't fill them.
Yeah. And
at first I didn't believe that. So I would call the pharmacists in the area, not close to here, a little bit a ways away, but I would call them and be like, what's going on? Because I'm getting patients from Dr. So-and-so, and the patients are telling me that y'all aren't filling his medication. What's going on? And they said, no, that's true. Yeah, none of us, like all of you, like CVS, Walgreens, the grocery stores. Yeah, we're all on the same page there. I'm like, well, what's going on? And like, well, the doctor is sending over prescriptions that, are a little bit outside of what we feel to be the standard of care. And when we try to reach out to him and figure out what the reasoning is here, he doesn't answer the phone. We can't get a hold of him. And, a lot of his patients are maybe even giving us trouble, and it just makes us feel unsafe. And so we don't want anything to do with it.
Wow.
So, as much as a libertarian as I may want to be, I think, the problem right now is that there's just maybe not every doctor is a good doctor.
Yeah.
That, that's just Just to put it out there. Not every doctor is a good doctor. And I don't know about this one doctor. Maybe there's a legitimate concern. Maybe there's not. I have no idea. I'm not involved in that. But this does happen. And so, patients are going to say, well, it's hard to be a pain patient. I'm telling you, it's hard to be a pain doctor too. We're on the same boat there, man.
We are.
Yeah.
But I think it goes a little further sometimes with pain patients. A lived example of my own. When I was living in Las Vegas, I had a year and a half consistent, same prescription, 7.5 Percocets every month. All went to CVS, and I went to pick them up after a year and a half of doing this. And the pharmacist on duty said, I need to talk to you. And then he came out from behind and he's like, have you tried extra strength Tylenol for your pain? And
that's like the best thing to ever say to a pain patient. Wait a minute. Have you tried Tylenol?
and I'm like, yeah, I did. I have. And I've tried Advil, and I've tried Aleve, and I've tried lidocaine, and I've tried all sorts of things like that.
Yeah.
But why are you asking me that? Well, we just, as a store, feel that you really need to try. I tell you what, this is what we've decided. We need for you to buy this bottle of Tylenol and try it for a week. And then if it's not helping you, come back and we'll fill your prescription.
Right. Yeah. Wow. So now we have pharmacists playing doctor, right?
Oh, it happens all the time.
Yeah.
It happens all the time. And, well, I understand they need to protect their licenses as well.
And that is a true thing.
I'm not going to disparage them for protecting their license.
They got to do what they got to do. Yes.
At the same time, I respect them. They need to respect the pain patient. And I'm not the only one that's running into that. Everybody says go to a small mom and pop, you'll get better care. But yeah, at times that overwhelms the small mom and pops, and they are actually restricted by contracts that they have with the mega, I don't know, what do you call them, the benefit providers, that they can't give discounts, or they can't write more than X, they can't dispense more than X amount of pills. So even their hands are tied at times. Mm-hmm. And that's just one of the aspects of being a chronic pain patient. That's hard.
Yeah.
I want to say life is hard, but everybody's life is hard, right?
Yeah,
in their own ways. I think what happens with chronic pain patients is we look fine. Mm-hmm. You looking at me, you can't tell that I have a lot of nerve pain in my feet or my back. You can't tell that my back is like a level 8 right now, right? Because there's not another arm coming out of my forehead to tell you that something's wrong. Mm-hmm. And so our partners, our spouses, our kids, our tight group, our people in our Bible study, people at our church, people that we see on a regular basis, our close friends, they get tired of inviting you somewhere, and then you tell them you're going to try to go and you're a no-show because you had a flare that day. So what happens is, as a chronic pain patient, you start out with this big circle of friends and family that are your ride and dies, right? You'll do anything for everybody, right? But after a period of time, you go from 30 down to 4, 5, 3, if your spouse still believes you.
Yep.
And it's not anything that you would ever want, but you can't do the Friday night happy hour anymore. And that's what everybody does. And
it's very isolating.
It is
to be
very
a pain
isolating.
patient.
It is. Mm-hmm. And I mean, there's so many more things. You even if you're adequately have the right medications, right? You are finding ways to get things like laundry done that are different than a normal person would do. Or your shower schedule is a lot different than a normal person. If you've been flaring for a few days, a shower is the last thing on your mind, right?
Right.
Or to somebody in normal society, I take 2 showers a day, one in the morning before I go to work and one before I go to bed. Mm-hmm. Not even thinking about it. Mm-hmm. Talk to a chronic pain patient or a chronic ill patient or somebody who's struggling with depression. Mm-hmm. It's not that they don't want to be clean. It's just they have to make a decision. Am I using that energy to get a shower, or am I going to cook dinner for my family tonight? Mm-hmm. And they're going to choose their family over that shower. I know it sounds stupid, but
no,
we do
sense.
These lives where the community comes together, and at the end of every single live, we do what's called celebrating victories.
That's good.
And we tell people, is it big? Did you find your unicorn? Did you find your unicorn? Let me know. Did you have a good visit with your doctor this week? Did you have anything big? Did you find the car keys you lost last week? Did you get a shower this week?
Mm-hmm.
And when we started doing that about 6 months ago, we would see the number of people on the live and it would drop like down to like 5, right? And it was the craziest, no matter how many we had, 30, 40, 50, it would drop down to 5 because people, they didn't get it. Now that number dropped, we may drop 3 people because all those people, those 30 people want to stay to share they got that shower or they had a good doctor's appointment. Because now, even if I didn't have any victories this week, you getting that shower today gives me hope that I'm going to have the strength to get that shower tomorrow.
Yeah.
Does that make sense to you?
Absolutely.
So we, as a pain patient or an invisible patient, we tend to celebrate different things than what typical society celebrates. And it's hard going to the grocery store. It's an hour and a half for me, no matter what, no matter how big the list is. Right.
Right.
And I don't need a walker and I don't need the scooter yet. Right. But it still takes that amount of time. And there's just a lot of little things in life. But you tend to learn to keep your mouth shut, because if you're at a 7 and your kids are being troublemakers, you have to learn to keep your mouth shut, because when you're hurting, your fuses are very, very short. And so you learn to keep quiet. You learn to put that mask on. And that's the myth we're trying to shatter with Invisible and No More, is take the mask off. Don't yell at your kids, but don't be freaking quiet anymore. You know, I had an attorney share a story where she's adequately being treated with different varieties of therapy and meds and all sorts of stuff, but she occasionally hurts, and she has at times she screamed out in pain at different events, and her family sat her down and said, "You need to stop doing that. It's embarrassing to us."
Sure.
And it's ableism at its finest. You have people like, "I don't do that. When I hurt, I stubbed my toe last week and I didn't scream out," and it's ableism is what it is. If I don't have to do that, you don't need to do that.
Right.
And
well, families are the worst. They have no, very little tolerance for, the weak link, so to speak. Yeah.
So when a family comes at another family member and says, "You need to control your pain better," normal society people, I know families can be issues. That's not something that happens. But it happens in the pain community.
Sure. Yeah.
Not
every family. I have a lot of patients with very supportive family members, to tell their credit, and we need more of that. Yeah. But it can be wearing on someone who especially doesn't have, the insight, the know-how. They're not walking in your shoes, and they see you as someone that should be stronger in their mind. And like I said, they don't have the tolerance for it. And just, come on, why can't you do that? Yeah, you can.
Yeah. And it's sad if you look at the statistics, chronic pain patient ladies, the divorce rate is through the roof because their husbands get tired of dealing with it and get tired of being caretakers. Yeah. And the ladies haven't done a damn thing wrong. Right. And yet their husbands leave. Right. And again, that's not every marriage. It's not in every situation, but statistically it's higher. The divorce rate is higher if you're a chronic pain patient, which is sad. Yeah. Which is sad, But we could speak for days on the different things that make it harder on a chronic pain patient. We mask so much because we want to do everything, right? Another example, I was talking with a guy who his kid's car caught on fire. And he was upset, and he's like, "I'm their dad. I need to be able to financially help them." He's like, "But I'm on disability. I don't have that." He's like, "I barely have enough to get my ramen noodles every month and pay rent and electric. I can't help him buy a new car right now." Yeah. And basically, certain generations of males were always brought up, you take care of your family no matter what. You go to work. If you cut your leg off, you still go to work. Absolutely. And you take care of your family. And when we get into the situation where we're blessed to have disability, when they hand you that first disability check, you're handing them your man card. Because your ability to take care of your family, your ability to have a job, your ability to get the lawn done, like you want to, all of that is gone. So that's another side of being a chronic pain patient that normies just don't get, because you give up all of that when you can't function because your body is hurting, or you have a disease, or you're dealing with a mental health struggle.
I'm glad you brought that up, Keith, because I don't think a lot of people fully understand sort of the behind the scenes impact that a pain patient has in the community, what they're up against, even just in their most intimate relationships, right? Let alone their public relationships. And it's much more than the challenges of just showing up to your doctor's office and being compliant with the plan of care and dealing with all the insurance nonsense and the scheduling nonsense and all the testing that's involved. That's just a small fraction of the whole experience. And that's why I love what you're doing with your group, because it really does, it speaks to a huge need in the community, sort of this national support group, so to speak, where people can come hear the challenges from other people. And that right there might be a huge part of the solution.
It's validating.
It's validation.
Yeah.
And it's education.
Mm-hmm. And it doesn't necessarily matter if you have a chronic pain issue or a chronic illness issue or a mental health struggle. We fight the same battles because you're all of our illnesses all of our diagnoses are invisible.
Yes.
And we've all been quiet for so long.
Right.
And it hasn't done a damn thing.
Right.
So why be quiet anymore?
Well, no, I'm
just my point of view.
I'm right there with you. I mean, now's the time to speak up. Things are not getting any easier. Mm-hmm. And so without that support, without that validation and that momentum for something better, we're all going to get lost in the dust. So, I think not only is the family member, I think they can be a huge help. They can also be a hindrance, and certainly unintentionally. When I was doing addiction medicine there for probably two and a half years, I was treating people who were addicted to opioids. Some prescription strength, in this case, a lot of street drugs. I don't think heroin was too popular even back then. It kind of phased out a long time ago. Fentanyl seems to be the main drug of choice, at least on the streets. But they would be in dire straits, right? They've lost their job. They're losing family members. Their health is spiraling. Their bank account is non-existent, and now they're at the bottom of the road, and they're in my clinic, right? Yeah. And a lot of the times I would hear the same thing that you described. Well, nobody understands what I'm going through. They think I'm doing this intentionally, and pain and addiction are two sides of the same coin. Yeah.
They both carry stigma.
They both carry stigma, and the experience may be similar on some end as far as the resources that are available to you, the understanding that people may have for you. And so oftentimes I would bring family members in and just kind of get their perspective. Well, I don't understand why he would do this. He had a wife and kids and he just didn't care about them. It's like, okay, let's start at the beginning. Yeah.
Let's back up a little.
It's not quite how this works.
Started before the wife and kids.
Right. So no, I think, in many cases, these patients are victims of themselves. And that's the sad part. I mean, we all are to some extent, but some experience that a little bit more drastically, and it's sad. And I think the solution lies in what we're doing here today. We're hearing each other's experiences. We're giving each other validation, education, support, and some type of path moving forward. And, it's going to look different for different people, but it's a good place to start.
It is a good place to start. Communication is the key. Right. Again, we may not agree, but that's okay.
Exactly.
At least we know where each other is. We understand better where the other person.
Well, and everybody has different perspectives.
Yeah. But if you can understand, then that helps.
Right.
in the long run, I think.
In your experience and from the patients that you hear, what are some of the challenges as it relates to encountering your doctor, going through the system in outpatient pain management?
Starts with diagnosis.
Okay.
And then it moves to if opioids are called for, can you get them?
Right.
And if you're getting them, is it an adequate dosage?
Right.
Right. And then you have to fight the insurance company to cover any type of prescription that you've given.
Sure.
I've had to get pre-authorizations for prednisone before.
Really?
Yeah.
That's amazing.
Yeah. So
just go pay cash. It's like $4.
well, but that's a stigma
It is
to the pharmacy if you pay cash for your meds, right?
Right.
If you don't use insurance. And the hard part's finding the right doctor.
Yeah.
That's the key. You have to really trust your gut, because you may get 10 minutes when you interview a doctor, and you have to make, and if you're, my experience, it took me 3 months. So that's 3 months without any kind of medicine, from gabapentin to an opioid. But I was having to say no when these doctors offered me a script, because my gut was like, this guy, I won't get along with him. So I'd have to walk out the door.
What signs or indications kind of make you sway that way? I mean, not only for my own information, but for patients that could be watching.
I would say when you present your story, you have about 3 minutes, or at least memorize a 3-minute. This is where I'm at. This is what I've done. This is what worked. This is what didn't work. And this is why I'm here. Right. You may not use that in that format, but you'll know that information.
Yep.
Okay.
I agree with this.
So, and present what's wrong, what you've been diagnosed with. Well, number one, I need to back up. Get your medical records. Know what's in them.
Yes.
Right. Don't so you're not surprised.
Yeah. Right.
Then do your 3 or so minute story. Thank you, Dr. Mike. And then present your diagnoses, what you can prove you've been diagnosed with. Present what you've tried, from PT to the different meds, to injections, to steroids, to whatever, included. Then be honest about what worked.
Yes.
And what didn't work.
And why.
Yeah. And then what's the reaction when you say, I've done all this, because you're going to get asked, why are you leaving the current doctor? Well, the solutions he's offering now involve surgery, and I'm not ready for that yet. I'm wondering, are there other options we can explore before I have surgery? And just be because to me, that's a fair question.
Sure.
And that's why I left. Well, one of the reasons I left my last doctor was that was the only option he was giving me, and I wasn't ready for that yet.
Yeah.
We hadn't tried acupuncture. We hadn't tried hardly any PT. We hadn't tried gabapentin. We hadn't tried ketamine. We hadn't tried all these different things.
Yeah.
Right. And so I felt just in my gut, maybe there's other things besides surgery right now. And so when I was interviewing these other doctors, I was explaining that to them. And 2 of the doctors straight up, well, if he's suggesting a nerve stimulator, then there's nothing I can do, because that's obviously what you need. And I'm like, okay, thank you for your time. He's like, well, make sure we schedule on your way out, and we can get the test for it done. Yeah. Okay. And, right. And another guy was like, well, he's just like, I see what you're saying. He's like, but new patients don't get opioids. And I'm like, well, number one, I didn't ask you for them. I just told you that they've worked for me. Well, everybody that comes in here wants opioids, and we just don't do it.
Right.
Okay. Well, have a good day. Because I never asked that gentleman for anything. All I had done was explain what worked, what I had taken, and what worked and what didn't work. And that I wasn't ready for surgery. And that's what he came back with.
Right.
And the interview here really was more about, where's your body? What hurts? What have they told you is wrong with you? What have you tried? Because I didn't give anybody a 3-minute speech here, but I was able to get all that information that I memorized, right? That's why you memorize it. So it's there. to get it out. And I was like, I had told you what the meds I'd taken, what I hadn't taken, and that I felt there were options besides surgery. I may get to surgery,
Right.
but can we try other things before we get there?
Yeah. Yeah.
So I would memorize that stuff, and I would be honest, you know, and I wouldn't walk in and demand meds right
Yeah.
off your bat,
Yeah.
but that happens. I think as a pain patient, we have to realize that it's not your job to get me to a zero right away. And don't expect that. Expect help, but don't expect that zero. And be willing to put the work in.
Yeah, no, I mean, I think it's extremely important to meet the patient where they're at on that first visit, figure out what their goals and expectations are so that we can make sure we're aligned. And then I'm just a fan of options. If it's just like, well, it's either this or that, then and none of those are aligning with your options, then I think not only is the physician missing an opportunity to help that patient, but the patient now, if I were in that position, I would feel coerced and controlled. And as soon as I start feeling that way, I get resistant. And, you know, and then I don't quite trust the doctor because it seems like, well, having been in this position, I know that there's always another option. And you should be willing to present that and offer it. Otherwise, again, why are you earning your medical degree?
Yeah.
It's called think of something else, you know?
Yeah, it really is. And that I just wish more doctors would be open to that.
It's hard to do that. To be fair, you are, you know, burning brain power to do that. And some patients may not be super open to it. And I think from my end of the fence too, like not every patient is like Keith. Not every patient wants to show up and be earnest and ask questions and be willing to participate or, you know, try different things. Like a lot of patients just show up, no, I don't care what you have to say. Write me a damn script. And that's where it's like, oh, now I'm feeling controlled.
Yeah.
And so that's why I think this communication, this conversation is so important because there has to be a middle ground. And I think with it, you can get a lot further by just being open to the different possibilities.
Oh, I think so.
Yeah.
Keep in mind, the patients need to keep in mind the goal is to get better.
Right.
And to yell and demand is not going to get you closer to your goal. It's just not. Just not.
Yeah.
You know, it's my opinion, but I've lived it in the past, so I've experienced, right? But yeah, we have to be better at patients, and we have to be willing to try different things. Opioids are getting harder and harder and harder to get, and that's not getting any better. What else is in your toolkit?
Exactly. Yeah.
So,
and I think that highlights too the importance of diagnosis, right?
Yeah.
I mean, if you know, coming from a patient's perspective, if my doctor wasn't willing to like, well, you know, let's look at this, let's get this image, let's do this test, let's run your blood for these levels and make sure that, you know, we're not missing something here. Because I think it can be easy to say, oh, well, you're telling me your pain is this, so we should do this injection. Well, but you maybe you missed 80% of the whole story.
Yeah.
You know,
yeah.
And not every patient just needs an injection. Not every patient just needs a prescription. Sometimes it's a combination of many things.
Many things. And the diagnosis is getting a diagnosis doesn't mean that I'm going to be cured.
Right.
But when it's 3:00 in the morning and I can't sleep and I want to scream, it gives me something to yell at.
There you go.
Right.
Okay.
It's like, okay, this diagnosis means that I have a crushed nerve at L3 or whatever. That's what's causing. Okay. I hate this part of I have something to yell at.
But it's validation too.
It is validation. And we're not told that you're a hypochondriac. We're not told that you're making it up. I have something, right? So it's not like I want another shingle to hang on my door. You know, oh, he has depression. He has sciatica. He has thoracic. And now I don't care about that. That's the last thing I want.
Right.
But what I want is if I can get a name, let me sit down for hours on end and research, are there any treatments? What are some of the treatments? What do people normally do when they have the situation?
Yeah.
You know, they may not be fixable, but at least I can yell at it.
I love it.
Does that make sense? I hope it does.
Yes, it does. Yes, it does. Well, thanks, Keith. And, I think that we could probably talk on this for hours.
Oh, yeah.
The challenges of the healthcare system at large, but specifically as it relates to pain management. For those of you watching, share with us your experiences. What have you found to be challenging, difficult, alarming? What are your red flags when you walk into a pain management clinic? Leave your responses in the comment. I will respond to them, and hopefully we can, come up with a solution as a community and help everybody live more with less pain.
Yep.
So
That's the plan.
and don't forget to give Keith a follow. Invisible No More.
Visible No More. If you go on TikTok, you can search for Keith, the letter N, Texas 99, or just type in Invisible No More, and you'll see a plethora of people or myself pop up.
Awesome.
There.
Yeah,
So.
check it out. It's good stuff. Until then, see you next time.